Hi, this is Dave, the pharmacist, once again from beautiful Oak Creek Canyon. This is an amazing area. I'd like to talk to you for just a second about evidence-based medicine. Evidence-based medicine is the foundation of allopathic practice of medicine. Now, allopathic practice is what your regular doctor you go to, or a nurse practitioner or PA, that's what they practice, allopathic. That's in contrast to naturopathic or homeopathic medicine. Allopathic medicine is supposed to be based on studies that prove that something works, so we use that therapy. Now, just because Uncle Fred rubbed a raw potato on his wart, buried it in the backyard, and now his wart's gone, that's not a study. When you get together a medical study, you have to have a large enough group to make it worthwhile. You have to have it be representative of the group you're going to treat. In other words, if you're going to treat urinary retention in older men, you wouldn't choose a group of younger men, 20 to 35, to test the med on. The second thing is you separate the therapy and non-therapy so that it's disguised to the patients and practitioners. You run it for a sufficient period of time, and then you collect the results. Then you decide whether or not the medication works or doesn't work based on the evidence of what you have. That's the basis of allopathic medicine. There are some cases where you have to venture past the evidence-based, and nobody does many studies on a lot of vitamins. There's virtually no studies on all of the natural products that you see on the shelf. They can make all kinds of claims for those products, and they've never studied them. Even if they ran a study, it probably wasn't set up properly. So the claims that you see on the internet for all kinds of products that are supposed to be helpful for this or that, and they work for this and scientifically proven, you can just throw it all out the window. If you want to try something, just go ahead and do it. And if it works for you, more power to you. But the chances are it's not going to. You want to get the best therapy, not just some random therapy that somebody dreamed up. There have been a couple of cases where our allopathic practices have really gone past evidence-based medicine. The most classic was the widespread use of estrogens in postmenopausal women. Everybody past menopause, whatever that age was, around 45 or 50, all the females were getting estrogens. They're getting Premarin. They're getting estradiol. By the way, Premarin is made from pregnant mare's urine. That's how they got the name, Premarin, Premarin. They used to have huge flocks of horses in northwest United States and in Canada that used to collect the urine from to make Premarin. It's still used some, and it was supposed to be used short-term for symptomatic hot flashes and the onset of menopause symptoms. But in fact, they used it much past that. They claimed it was good for your heart. They claimed it was good to prevent strokes. And actually, they found out it was just the opposite. The estrogens were actually increasing the risk of stroke, increasing the risk of heart attack, and increasing the risk of breast cancer. So what a horrible venture into non-evidence-based medicine by the allopathic practice. I'll give you another example of what has happened with non-evidence-based medicine. When we were in the COVID outbreak and we started shutting everything down in the United States, there was really no evidence for shutting down businesses. We killed a lot of businesses. We drove a lot of business from local retail agencies to Amazon. We shut down schools. We set our kids back in their education tremendously. There was no evidence for doing a lot of that, at least no benefit-risk evidence study. So we did a lot of things in COVID that really didn't make a lot of sense. And I hope you realize that was not evidence-based practice. And it cost the allopathic medical community a lot of confidence in our practitioners as a result of it. And that's really too bad. I'm convinced that one of the things we're going to find that we're doing currently that's non-evidence-based, that we're going to find out is not helping people, is vitamin D therapy. There is no evidence-based practice for the use of high-dose vitamin D therapy in almost all the patients that we're using high-dose therapy in now. We've got a lot of patients on high vitamin D. What it does, of course, is increase their risk of having kidney stones, increase the risk of calcium deposits in arteries, calcium deposits in soft tissues and in organs. I'm convinced we're going to have that in the future. So I want to let you know that we should all be thinking about evidence-based practice and make sure we hold fast to that principle. Thanks. If you like this video, hit like and share it with your friends, and I hope you have a nice day. Thanks a lot. This is Dave, the pharmacist.